Now, 12 years ago, the country embarked on a bold journey, devolution. This was meant to take resources and decision-making power from Nairobi to the grassroots. Today, a decade later, lives are being saved in county hospitals. Babies are being born in facilities that never existed before. And the local leaders are shaping their communities. But beneath the progress, deep cracks remain. Corruption, delayed disbursement, and poor leadership. Tonight, Ben Chumber takes us across the counties and into the corridors of power to examine what's working, what's failing, and who is paying the price. We begin in Meru County, where the surgical first was changed everything.
Inside the surgical wing of the Meru Teaching and Referral Hospital, for the first time in its history, Dr. Zia performed a complex total hip revision surgery, the kind of delicate procedure many patients used to travel hundreds of kilometers to Nairobi or India for. Led by Dr. Kinyua Ndegwa and his team, the operation lasted 4 hours and involved removing a failed joint, rebuilding the bone, and installing a new durable implant. It's a technical feat, but also a triumph of devolution.
Now, because of the capacity and the goodwill that we see in the county government, led by His Excellency, our Governor, Reverend Mutuma, we have now better capacity and increased capacity to do even more joint replacement surgeries. And even now, we're doing revision surgeries here at Meru Teaching Referral Hospital. The
achievement is more than medical, it's symbolic. Patients from Meru, Isiolo, and Tharaka Nithi now have access to cutting-edge orthopedic care. No long travel, no private hospital bills. About 300 kilometers away, another miracle was unfolding in Makueni. At Makueni County Referral Hospital, a 69-year-old had spent months battling migraines and terrifying seizures. He feared the worst and never imagined that salvation would come from home. In a 6-hour operation led by neurosurgeons Dr. Muthoka Mativo and Dr. Angela Murunga, a tumor was safely removed and a life reclaimed.
We've also been able to keep the patient in ICU. He's doing very well, actually. I was able to see him today in the morning, and so we can say that our operation was successful.
Vile tulifika tumepata daktari mzuri, akatushughulikia, akatuelezea process vile iko na vile watafanya. Akasema ni kitu inaweza fanyika Makueni na hivyo hatufai kwenda KNH.
But in Kiambu County, the triumph of devolution exists besides its challenges, vividly seen through the eyes of 28-year-old Purity Njeri.
I came here nikiwa na bole ya 5 months, so nilisaidika juu first of all walisave mtoto wangu. Hakukuwa na hospitali ni isipokuwa hii.
Purity's premature baby now thrives in the newborn unit at Ruiru Level 4 Hospital, a facility that didn't exist a few years ago.
It has reduced mortality rate. For example, a preterm, a baby mwenye hajafika siku amezaliwa, before referring your system, everything ulikuwa unapata. By the time they are referred, they sometimes don't make it, making many of them not survive. But now we really helping,
and I'm happy. Wananiangalilia mtoto vizuri, nampea maziwa vizuri, na benefits za huku ni ati mama akiingia anakuja akiwa sad, but akitoka she's happy.
But even miracles face limits. The hospital is bursting at the seams, sometimes 3 newborns to a bed. The staff works with compassion, but too often without enough space.
We get around between 350 and 400 deliveries in a month. And comparing the capacity of our maternity, it is very small. It's not able to cater for the many deliveries, so most mothers are sharing. We also have a charge of the antenatal. They mix with those who are laboring, and we really need an antenatal ward where we can keep those mothers before they reach the active phase of labor.
These stories of surgery, birth, recovery are the human face of devolution.
Thank you very much.
But beneath them lies a more complicated truth.
We have those people, governors, who know why they are there, and we have those governors who don't know why they are there. Yeah, they are just there to eat money, finance, or public resources. But the idea of devolution is one of the best ideas Kenyans came up with.
According to the Control of Budget, 38 counties failed to meet the legal development spending threshold last year.
For example, the other day, the Minister for Health was telling us that he's going to transfer all the UHC clinical officers to the counties because he doesn't have money. Now, does county have money? If the health guy doesn't have money, where will the governors get money?
As of May 2025, counties are still owed nearly 75 billion shillings. National government insists counties are misusing what they get.
A county with 10 MCAs and 36 advisors and 31 chief officers, that is madness. You can't tell us that that is justified and that you're going to do it because your staff establishment says so. That is completely out of order, completely unacceptable, Governor. Chair, that you cannot get away with.
But I can confirm, Chair, the other 32 officers are officers under the County Public Service Board.
But if you know what devolution is and you are given resources, you use it very well rather than politicizing things. For example, you have used money, you have squandered money of devolution. When you are arrested, you politicize.
Meanwhile, the Kenyan people are caught in the middle, paying taxes, waiting for promises to materialize. Despite the bureaucracy, the debate and the drama, counties are fighting to push forward. Ben Chumba, Sunday Express.